So you might have noticed that when we went through the therapies, we went through surgery, chemo, radiation therapy, and hormone therapy, that one of the common side effects to all of these treatments was fatigue. So cancer-related fatigue is a particular issue among survivors. It's different from usual fatigue. It's characterized as being severe and distressing. It's persistent. It's not alleviated by sleep or rest. It's experienced in proportion that's not in proportion to recent physical activity, and that the fatigue that experiences well beyond what would be expected for a given activity, and it certainly interferes with survivors' daily activities and social functioning. To give you an idea of the scale of the problem, we can look at the proportion of survivors that report in the dark. They're either a lot more difficult, or in the lighter they're somewhat more difficult, different activities of daily living. So we see down the bottom there, walking distances, getting exercise and cleaning the house. 3/4 of survivors essentially say they experience either a lot more difficulty or somewhat more difficulty doing these jobs because of this cancer-related fatigue. But then, I mean, that can be expected. This is exercising, cleaning the house, but you can also see in just general things like preparing food and eating meals that half of the survivors will experience more difficulty in these even simple tasks. So you can see it's quite a big issue for survivors. The symptoms of fatigue can be present at diagnosis as a symptom of the cancer itself. It can develop during the treatment as a side effect of the treatment, or it can develop following treatment as a late effect. In many cancer survivors, the fatigue is going to persist for months or years following completion of cancer treatment. After surgery, there's a fatigue. It's physiological, and it's cumulative on the chemo and radiation therapy, in that all the treatments that the survivor has or the patient has accumulate this fatigue. And in 72 to 95% of patients receiving therapy in terms of surgery are going to experience fatigue. 45% of people after 1 week of chemo, and another third after 2 weeks, are going to experience fatigue. 3 to 4 days following their treatment or their dosage of chemotherapy, they're going to experience it, and it gets severe after about 10 days. Then they'll improve until the next cycle, but you can see that these things build on each other. In radiation therapy, fatigue will be at its maximum around the 4th week, or average of 17 treatments, and it's known to be biological, and it's independent of depressive symptoms. So even if someone isn't experiencing depressive symptoms, they may experience this fatigue. And it's also one of the major reasons why people will discontinue their radiation dosage, because of this, the severity of this symptom. 78% of patients experience fatigue significant enough to affect daily living. 61% say it's more significant than the pain that they experienced. However, only 35% of doctors offer treatment specifically for fatigue, and advice to rest and recover only exacerbates fatigue. It actually makes it worse due to deconditioning. So you can see that if we're trying to treat someone with exercise, it's going to be a big part of our role to try and explain that exercise is actually going to help their fatigue, and that resting and avoiding activity is going to make it worse. There's a number of factors contributing to cancer-related fatigue and cancer treatment: hormonal changes, changes in metabolism, stress, anxiety and depression, anemia. Obviously that's going to make people feel fatigue. Altered sleep patterns. Some people will be given dosages of corticosteroids with their chemotherapy, and this will keep them awake. Treatment side effects: pain, nausea and dyspnea. Inactivity leads to impairments in cardiorespiratory fitness. Obviously we decondition. Changes in muscle function, we lose strength and power, and it could make the cancer-related fatigue worse. But there's few studies to date that really elucidate fully for us the mechanisms of cancer-related fatigue. Lymphedema is another side effect, and it's usually due to the lymph nodes being scarred or removed, and scarring being left behind after surgery. Obviously, sometimes the lymph nodes have to be removed. So they end up with a blockage of the lymph system, and they end up with swelling in the periphery. And we can see in the photo here that the person is very swollen just on one side, and that's the side where the lymph nodes would have been removed. They're certainly going to experience discomfort, can be painful, and they're going to lose function in that the range of motion that they have in the joints around the area is certainly going to be reduced. Exercise is an important part of treating, but we need to make sure we monitor limb size and make sure we're not exacerbating the lymphedema. Depression and anxiety is experienced by 20 to 50% of cancer patients. It may be related to their change in health, also loss of fitness and conditioning, but also feelings of helplessness, pain, and these changes in body image that I mentioned earlier. It might present as someone who becomes more quiet, decreased communication, inability to sleep, lethargy, and fatigue. So fatigue does tie in with this as well. Mood swings, forgetfulness, and cognitive problems might also be present in people with anxiety and depression. So this is a general summary of the side effects of different types of treatment most commonly experienced by cancer patients. And again, as I said, fatigue is one, along with pain, that's present with all of these treatments. Now let's just look at the lifestyles of cancer survivors and how these side effects affect their lifestyles and how this might be important to us as exercise physiologists or exercise scientists. Cancer survivors in their middle age, there's still a high proportion of smokers. 3/4 are physically inactive. They generally have poorer diets. Most are overweight, and some consume excessive amounts of alcohol. If we look at the effect of treatment itself on physical activity levels, when we look at changes throughout the time course before treatment, during and after treatment, we see that during treatment we get a big increase in the proportion of people who are doing no physical exercise at all, and that tends to bounce back after treatment. But sometimes this treatment period can last a while, and during that time they might lose some condition in terms of fitness and muscle strength and size and power that they're not going to readily gain back just by resuming their regular type of activity afterwards. And still there's a large number of people who remain insufficiently or inactive after treatment. And this is different types of cancers, and we're looking at during treatment and post-treatment. Again, even post-treatment, the proportion meeting the 150 minutes a week guidelines is quite low, but during treatment, again, it's very low. And so perhaps the treatment phase is a good opportunity for us to make a difference in cancer patients and cancer survivors' lives. And physical activity is important for cancer survival in terms of developing the cancer and surviving the cancer. If you're physically inactive, you're nearly twice as likely to develop colon cancer. Those who are active have a 30% reduction in the risk of all ages of developing breast cancer. It reduces prostate cancer incidence of advanced forms in older men. So if you do over 3 hours a week of vigorous exercise, you have a 70% risk reduction of developing prostate cancer and a 20% reduction in risk of developing lung cancer.